As students enter into the clinical practice environment, we want to arm them with the confidence to take care of the patients that they're assigned to. One of the key features of the Pyxis MedStation ES is allowing nursing students to select the patients that they will be responsible for care delivery for during the course of the shift in which they're working and providing patient care. So right now I'm on the main menu screen and I'm going to select the patients that I've been assigned for that particular shift. So I select my patients, and I already have a patient on here to show you how the general layout looks. I'm then going to select Edit Patients, and I'm going to select the patients that I've been assigned to care for that particular shift. So I'm going to select Albert Fossil, I'm going to select Sally Green, and Robert Orr. And once I've made those selections, I'm going to click Accept. I now have a screen customized to my patient's assignments for that particular shift. If for some reason a patient is discharged or transferred, I can remove that patient. Or if I receive another assignment because of an admission or because of other factors impacting patient care assignments, I can add a patient like I did with Amanda Gray. Once I've made those changes, I'll click Accept, and you see my new assignments are now listed here on the screen, ready for medication removal and specific to my assignments for that day. As we prepare students to transition into care delivery as licensed professionals, one of the key features they'll learn is how to accept patient assignments. In stepping back a little and looking at the student perspective and how we prepare them clinically, let's talk about how we can specify assignments made to students during their clinicals that allow them optimized access to medications that are due for their patients. We're going to create a specific My Patient list for our student. Here you've seen that the preceptor may have assigned one particular patient for a nursing student to care for tomorrow during clinical rotation. We're going to actually edit this list because as a clinical instructor, I've decided that I actually want this student to take on 2 additional patients because patient Lauren Black is scheduled to be discharged. So I'm going to go ahead and assign Sally Green to this nursing student as well as Danny Childs. So now this nursing student has 3 patients that they will be caring for during the course of their clinical rotation today. And by clicking on Accept, that student now has a customized view of the medications that are due for all 3 patients they will be caring for over the course of the clinical experience. It's Lauren Black, Danny Childs, and Sally Green. For this particular view, we can see that Danny Childs has medications due at 12 o'clock and at 3 o'clock. This allows the student a quick visual in terms of what's coming up from a medication activity for the assigned patients. The student can also quickly access any PRN orders that are available for symptom management or all orders. And I'm just going to select a PRN that we can see Danny Childs has morphine available if it is needed. I'm going to cancel out, and that takes me back to my screen because the student has been notified that Lauren Black is to be discharged. The student performs all of the discharge-related activities for Lauren Black and now wants to remove Lauren Black from their customized view screen within Pyxis. I'm simply going to click on the X. Now there are 2 patients assigned to the patient queue and the student's queue. I click Accept, and now that patient has a customized view of the 2 remaining patients that they're caring for.